And I just find it really, really funny that, like, last week, no one fucking knew what ivermectin was. They didn't know what it was used for. They didn't know it was an actual medication. But now, all of a sudden, you give a shit. And now you're using refugee health as a sort of political prop to push more of your anti-vaccine, pro-ivermectin agenda. But let's stop pretending that you actually care about the health and safety and well-being of refugees, because you don't. And using them as a prop like this is really disgusting. Listen, if you want to use ivermectin to treat COVID-19, then by all means, feel free to prescribe it to your patients. If you are not a doctor or incapable of prescribing ivermectin to your patients, well, here's what you do. You just go and take your MCATs, get into medical school, graduate medical school, go to residency, become an attending, and then you can prescribe all the ivermectin you want to your patients, and then you can write up your results in a peer-reviewed scientific paper and share your results with the overall scientific community, and then we can have that chat. Y'all think being a doctor is super easy. You tell me enough in my comment section, so go ahead. Put your money where your mouth is, and I'll be waiting for you on the other side. Have a great day. And Peter McCullough, you mean the guy who's being sued by Baylor University because he's lying about being affiliated with them? You know, they're suing him because he's spreading COVID-19 misinformation and misrepresenting himself as being on faculty there. So yeah, if you want to count him as one of your credible sources, go for it. So yeah, you can always find people who support your opinion, but just make sure that you look into what those people stand for, because that wasn't really the greatest group of people to base your opinion on. But, you know, you're going to do you, so best of luck.
Each doctor, one by one, had to make a decision. When the next patient called and said, listen, I'm sick with COVID-19, can you help me? There was a binary choice. The choice was, no, I'm not going to help you, nothing works, there's nothing I can do, just wait until you get hospitalized. Or the answer could be, you know what, let me try. Mm-hmm. And what we found is that binary choice was the biopsy of who really had courage and who really had excellent clinical judgment. And doctors who were not confident in their clinical judgment quickly said, you know what, there's nothing you can do. And they got into that groupthink. And that could have been 90% plus of doctors had a lack of clinical judgment and a lack of courage. And what I found in this whole thing is those two things are rare.
To hold on to the position of denying compassionate care to patients and to create fear, suffering, hospitalization, and death is immoral, it's unethical, and in civil court, it's illegal. And all of you will be hunted. Every single one of you listening right now will be hunted, and justice will be served. These are considered crimes against humanity.